As we know about the Australian cannabis industry, there comes a lot of criticism at times, a lot of opinions around what's happening. What are the different standards that we see? What is the quality in the market? There's no better man to get on the podcast than Angus. And in your own words, can you introduce us to the audience and tell us a little bit about who you are, what brings you here, and where we're going to go today?
Sure, mate. Thanks, Chad, and thanks for having me. I'm Angus Chappell, the founder of. We supply cannabis solutions to Australian patients, particularly around phytocompound technology. So we aim to provide the best solutions for patients, leaning into the science as much as we can to try to understand how do we get the best efficacy out of this revolutionary new medicine.
And what do you think? Like you've seen where we've been in the last year and recently I've just seen this week has been blowing up, right? Around cannabis. You've had Huberman, one of the biggest health podcasters in the world. This week you've had Dr. Amen, who's a psychiatrist and brain specialist, come out and there seems to be this rhetoric around cannabis and someone who's so passionate about it and someone who's mentioning efficacy. How do you take that on board when you're such a strong advocate, you believe in it? How do you make sense of, I guess, some of the noise that's surrounding cannabis at the moment?
Look, it's a great question. The noise used to irk me, if I can use that word, because
Mm,
I felt like there was opportunity for people to have really meaningful conversations. But now, with the fullness of time, I've been doing this since 2018. So a little while. Scientifically, that's a really
yep,
short time.
sure.
Um, any conversation I love about it. I love it brings awareness. If it triggers a conversation between two
Mm,
people or a household, I think it's of value. I think when you start to break through the noise, as in if you take all of those conversations and everything that's being said and tried to find a common thread, what one of the things that you can pick out is that we don't really understand what we're talking about that well. So again, it used to irk me that the industry was full of Dunning-Krugers, five-minute experts. But because it was prohibited, because the scientific development was arrested as a result of that prohibition, we really do have a lot of work to do to try to get up on board with what's really going on.
mm,
It's a complicated thing. I
yes.
everyone. I go about my everyday. You say Huberman, and people are talking about it. Even in my everyday world, I go to the shop and I buy milk, and people say, "Oh, what do you do?" And then we're having a cannabis conversation.
Yeah.
It really is everywhere. Completely agree.
And one of the things that I take on it, I have always, and I'm not saying I'm right on this, but I think it comes down to,
People love
among
being right.
other factors, yeah, three. Yeah. How is it used? So what does consumption look like? And then the behavior of the individual.
Mm.
What's the legality of some of the criticism, the studies that are informing some of this, yes, some of the news that has been coming out? Is that actually like accurate? And are there many factors in terms of, well, someone was needing to pursue this in a way and it's causing stress and there's criminality associated with it and compounding up factors? How much does that potentially influence some of these data? And the final one would be, what product are they actually taking in quality? And that's where I think we're going to go today. Because the biggest question, particularly when you've just given us that wonderful introduction around, we still don't know a lot, right? But what we do know, these laws have been in place, but in our country, in Australia, under 10 years. Cannabis, there's in Canada, there's a bit more time to lean on there in terms of the medical application. But what do you like? What does that inform your thinking at all in terms of, well, what are people actually consuming, and have there been standards that they're taking, or are they, smoking something which has been dipped in WD-40, it's laced in something from the cartel, and they're accessing that on the streets of America? Like, do you know what I mean? There's a difference, I imagine, between what is top quality cannabis and what are the conditions around that and the standards compared to who knows what is in some of these products.
It's a really good point, and in reverse order, I'll try to remember because there's quite a lot of questions in there. Um, but in reverse order, it's everything. So people
Yep.
are taking street cannabis that was grown in someone's combi or in the
Yep.
basement,
Making it
um,
more wet, getting the weight up by dipping it in who knows what.
dipping it in who knows what, right? Some of that stuff actually made its way onto the recreational market in bags that it's dipped in THCA. I don't know if you've
Yes.
seen that, but it's the white powder coated in white powder. The THC numbers are off the chart. It sends you, to the wall, right? That's one part of what's going on. Um, all the way to the other end of the spectrum, you've got Nana, who's getting great results from CBD
Yes.
oil that she's never had before, right? So again, it's a really difficult to talk about
Yep.
this cannabis in one context.
Yes.
It's actually there's no
It's
relevance to.
impossible. It's impossible, particularly in the time that we've got. But where we can go, and where I
Yep,
don't think people go enough, is what is the and let's just focus on Australia for now, right? There's a lot of attention on
sure.
Australia from global markets, so let's just focus on the Australian market. I imagine that's where you've got the most expertise as well. But if we're talking just okay, maybe before we get there, a bit of a spread. If we're to look at the Australian market in terms of rough percentages, not going to hold you not going to hold you to it, but where do you think the market is focused on? Is the market focused on we want the best quality cannabis and the patient really cares around standards. The patient also cares around the health components of that, and it's like the way it's been grown, been up in Canada, and it's been Australia bush, who like whole range of different factors. Or is it the price
That's
sensitive
5%.
Australian?
That's
How much?
5% of the
Five
market.
percent Okay. And then the middle range, roughly.
The middle range, what are we talking about? We want it to be good, but it needs to be affordable. Is 65% of the market.
Okay. So mass market is we care about quality. We don't want the top, but price is also a factor, and I'm going to pay within what sort of ranges there, mate? What are you saying in terms of
Yeah,
flower?
so I would say if we're talking 60%, then 30% of those people will have a metric around quality or a decision input around quality. But normally they've got a price range. The other 30% are literally just buying it because it's on offer and it'll do the job. And then the rest of the market could not care what they get as long as it's green and it gets them high,
Yep.
right? So when we say what is quality, one
Yes.
of the questions that we need to put that into context is why. Why is it important? Who care? Why should you care about quality, right? Who cares? Most Australians, from what we see, like I said, 95%, meh, seems okay. It's green enough. It does the job. Great. That's great. The reason that you don't care is because the why isn't really that concerning to you. What we've found, so
Can I?
let's
What
say
What do you mean by that? Yeah. Let's just double tap on that. What do you mean?
why I'm having this. My reasons are fairly broad. I just want to feel a bit better.
Hmm.
If my reasons are very specific, then I do really care about quality
Hmm.
because I tried this product and I got a great result, and I tried that product and I didn't get the same result. And I
Or
don't know.
tried this product for a little bit, and I don't really remember having headaches like this all the time. But there's a little brain fog that comes with it every 2 to 3 days, and there's these headaches that I get when I don't usually get them. Am I tired? Is there other things going on in my life, or is
Sure.
it the quality of product that I'm taking?
So these are the whys, and everyone has their own why. So I think as an industry, what we need to do is to be able to give people a uniform measuring stick for quality, which means we start to understand what it actually is. What are the components that make up quality? So in Australia, and I know that in lots of other jurisdictions, incorrectly, it's the THC number. That's not a quality measurement. People say, "Oh, I need a, I've
Yes.
got chronic back pain and I need a 25. As long as it's a 25, it's good."
Yep.
Wait, hang on a minute. we've got a scale. There's 100 points, 100 different things that we measure to determine a quality number, right? And it's the same for every product. So it's
Mm.
unbiased
Is
and
that
it
only
doesn't
is that only flour, or can you apply that to pastels,
pretty
oils?
much flour.
Sure.
Pastilles and other things need a different, there's a different metric there because it's an
Yeah.
extraction.
Cool.
It starts from that original flour, right? Unless we talk, I'm not talking about synthetics, totally
Sure,
different.
sure, sure.
Let's not go there. So the starting input is raw flour. So
Sure.
let's measure that. And then you can extract, you can make everything from that.
But
So
so one thing, mate. So say you've got a 100 point scale, which you use, yeah, within your to produce the solutions that you do. We can't just like keep people here going, well, we're not going to go through 100. But what are some of the
no
main
way.
ones you think? Yeah. So what are some of the main ones and some take homes? Because if we're to support people to understand more about what their why is, that comes back to patient education, right?
Mm.
Which is what we're doing right now. And so to help inform the why, yeah, we're going to need that efficacy data. So we're going to need research to help them,
Sure.
help their clinicians, help wider healthcare. So it's not just in clinics, but we can spread the awareness and utility of where cannabis medicines, medical cannabis, whatever we want to call it, comes into someone's life.
Yeah.
But if they want to know, okay, I want a quality product and it's not just based on the 25%, as you indicated before, what are 5 to 7 things that, would be, what make a quality product? And when does that start in terms of, yeah, like at what point does that process start?
Great question. I love it. And patients should be interested in this stuff, and so should their
No doubt.
physicians, because what you're trying to do is get a result. We're talking
Yes.
about efficacy, right? And and what we really would like to do is get the best result for that patient. So it
Yes.
means you need to understand some stuff. Let's work backwards.
Yep.
GACP and GAP and GMP, right? GACP, good agricultural collection practices,
Yep.
is not a quality standard. It means that you are collecting data and storing data so that somebody can come along later and audit it. Great. If you're not doing that, you're not a medicinal cannabis grower. You're a grower, right? You're a different kind of grower, right? I'm not saying anything's better or worse,
Sure.
but
Sure.
medicinal cannabis, the primary concern in Australia, and I suppose in a lot of other jurisdictions as well, is consistency.
Yep.
So how do you get a consistent flower? Because you need to get a
Yes.
consistent result for the patient.
Yes.
If the flower changes too much, then the patient may fall out of their efficacy window completely, right? And still
Yes.
be on
Yes.
the same flower.
Yes.
That's the worst case scenario. So doctors all want consistency, and so do patients. Okay, great. You need the systems in place, GACP, that's a great place to start because you're collecting the data. But you need to be able to review and understand and analyze that data as well to understand, okay, where did this variation come from? If I've gone this crop in Q1, this crop in Q2, this one in Q3, this one in Q4, I have a heap of data across those batches,
Sure.
and I need to be able to analyze that and see, okay, what changed?
Yes.
If we change any of the inputs.
Yep.
We didn't change the fertigation regime. We didn't change the medium that it's grown in. It's all rock wool or it's all living soil or whatever. We didn't change that.
Yep.
What changed to produce this variable at the other end? One of those things that's not very well understood is epigenetic drift, right? The plant, every time you take a clone and propagate it, you're
Mm-hmm.
introducing the potential for disease and degradation into those genetics. So at the end of the scale is GACP, collect and analyze the data. And I don't know how many people do. Certainly, a couple of cultivators in Australia that I've spoken to do not do that. They collect it because someone might come and want to have a look at it one day. No, hang on, that data is for you, right? That's for you to do a better job. Then right at the very other end of the scale is genetic input. So
Mm-hmm.
where did the genetics come from? How stable are they? Who did the breeding?
Yes.
Has some of the inherent genetic disease been bred out of them? Right?
Mm-hmm.
If a um, if a crop is leaning towards producing mold, they should never be propagated ever again. You breed that out. You breed out disease, you breed out the weakness in all of the plants. Crop steering and breeding, really important in the genetic part. So if you just buy a bag of seeds from Dutch Passion, right? Hey, this is a cool sounding genetic. Hey,
Yeah, yeah.
bubblegum, macchiato. Okay, great. But what's the stability? What's the lineage of those genetics? If you've not started there, you're on this road to non-repeatability from the start, right?
Yeah, yeah.
You're making it really hard for yourself. So all of these things add up to quality. Okay, one market, genetic pedigree. What are the genetics? Where do they come from? Are they a true representation of that
Hmm.
genetic? And how stable are they? Tissue culture. Tissue culture is really important when you want to do propagation and remove deficiencies in the genetics. Like humans, you inherently attract deficiencies. One of the most common ones in cannabis cultivation is not particularly a disease, but it's ever decreasing propensity to produce API. Every time you cut it, it'll get less and less and less and less. And the growers that are out there listening to me know exactly what I'm talking about. It's a real pain in the ass, right? So that's just epigenetic drift. That's what the genetics do. They need to go into tissue culture and be cleaned and refreshed and have all of that stuff taken out on a regular basis. The same as the way that you look after your mothers. Very important to get a repeatable, consistent outcome. So I would say the biggest marker, sorry, of quality is consistency. Can you do it over and over and over and over
Hmm.
again? Because
Hmm.
that patient that's really relying on your product
Hmm.
to get the super result that they're really after
Yeah.
wants it every week,
You want
every
the
month.
cheeseburger at McDonald's wherever you are, right? You just want it to be the same. Yeah, if you,
And you
you know.
need to be able to do it over and over and over. You really need to know what you're doing. The guesswork, all the guesswork needs to go, right? And
Hmm.
then, so that's just some of the ways that we see from our growers, the consistency. So before we engage them, we wanted to see 4 years of data.
Yes. All
I
right.
want to see 4 years of COAs before we even agree to buy a single batch, right? How
Yeah.
good are you at doing this? And it's amazing. It's actually within a couple of percent. So it's
Can
really
I ask
quite
a
important.
question, just tapping in on that there, right? So there's no way, yeah, if you're providing solutions to cater for that 30% of the market here, and I dare say half the 60 that you referred to, yeah? So that's more than half the market. You're going to
Yeah,
worry about this at all because you're not focused on that. The patient isn't going to care around quality of the end product. And so if your end customer doesn't care about these things, the standards in place for a lot of the market is going to be like because it's not factored in, and anything there is adding in time and cost. And so if you're adding in
exactly.
time and cost, you're going to
Exactly.
then have to have where is that going to come into the market at, right?
Yeah,
And so
you
then,
become overcapitalized. Yeah. So that's one of the things that you talked about at the start is, let's talk about Australian growers.
yeah,
Everyone has, not everyone, most of them have shareholders. So you need to make the numbers work. And so there's a certain amount that you can spend before you need to start getting a return. You need to make the whole thing profitable. So most of the market in Australia don't care about quality. We're talking about raw flour going straight to the
yeah,
market, dried, cured. Maybe it's not cured. We're
mm-hmm,
talking about dry herb. This is also part of, I know it's a bit of a dirty word, but the semi-rec market. So a lot of them, like I said, the reason that they came isn't very
medrec. We were
specific,
talking about last week, man. Medrec. It's it captures
right?
the market.
So you don't need to be that good at growing to satisfy that need. You don't need to be. And that's some of the only reason why some of these Australian growers and other growers, of course, I'm not singling them out, but let's say inexperienced growers,
Mm.
this is the reason why they're surviving because most of the market doesn't care what they get,
Yeah.
right?
Just
Or they
one.
don't, sorry, they
What?
don't know. For a
Mm.
start, they don't know. But ultimately, they'll just buy it and they don't care. They're happy.
What about this question? And again, where do a lot of these products and the genetics come from? Potentially, it's already overseas in some cases, right? But just in terms of the output, yeah. So the output of the very best Australian flower, how does that compare on a global level? So where are you saying Australia is in terms of other markets, right? Thailand, USA, Canada.
Mm,
There's some markets that you can kind of travel to and sample
yeah.
rather than medical markets that you may not be as versed in, right? But just what do you think? And what's your information? Because I think this is an interesting one for Aussie patients. It's like, how does our product actually compare? Like,
I
what's your
think it's
thoughts on
middle of
that?
the road. Yeah, I would
Yep.
call it MOR all day, every day. It's middle of the road.
And
So
that's our best,
that's
Australia's
our best.
best.
That's our best.
And who's doing it the best? Where are the best options?
Well, that's probably subjective.
Sure. What are your thoughts?
So, so I would say it's absolutely a competition between, Cali and British Columbia. California and British Columbia
Yes.
would be the standards. And
Gotcha.
again, for the reasons that I talked about before, we're talking about where are the best breeders? Where's the
Mm-hmm.
best genetics coming from? If you haven't started with cracking genetics, you're not going to get a cracking result.
Mm-hmm.
So, Cali, uh, world-renowned breeders. That's all they do. They're not growers. They don't grow. They don't care about growing. They care about genetics and breeding. That's what they do all day, every day, breeding, 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 right? Producing genetics. Oh, if we cross this with this and we hybridize and we back cross that, and that's a whole nother thing. It's a whole, I've spoken to really good growers about it. Oh, could you reckon you could hybridize? And they're like, no way, I'm not touching breeding. I'm not touching it. It's a whole
Gotcha.
area of expertise. That's why Cali's on top.
Mm. And British Columbia?
Uh, and British Columbia is because they source a lot of their genetics from Cali, right? So um, once you've got the genetics, then how dedicated are you to seeing the genetic potential? So let's just briefly describe that scientifically. The genetic potential of the plant all the way through cultivation and production and manufacturing and GMP and everything that we've created this pathway eventually translates to the efficacy potential for the patient. If
Mm-hmm.
you start shortchanging any of
Yeah.
those
Yeah.
processes,
Yeah.
you're shortchanging the efficacy. And I'm sure that's easy for everyone to understand.
Mm.
Maybe we can do a deep dive on another
Sure,
episode,
sure.
but
Love to.
that's the high level.
Mm.
That's why quality is important and why it needs to be better understood. Yeah.
Can you only be at a C level and consume to go for quality? Can you be at a C level who's a decision maker, right, in terms of quality standards within an organization or a company, not consume and strive for the best quality? Because can you even understand what that means?
It's a
You
great
get me? You
question.
get me?
Yeah, I get you because quality is subjective and we can interpret quality as a consumer. We can
But also,
interpret,
if you're just making the very best for you, yeah,
sure,
and you want
sure.
your consistency and your patient number one, well, then you've already got the best quality. I'm not saying this is applicable to you. I'm just
Yeah,
saying
yeah,
that
sure.
I'll use on tracker, for example, right? Like I knew when I started it, regardless of what happened, failure wasn't an option because now I've got a little system that keeps me on track and it gets better all the time. And I understand what's going like I've won in many ways, right? Because I've built something for myself. And regardless of what happens, it doesn't matter. And
Yeah,
that
yeah,
makes it
yourself is
very
clear.
hard for competition. Do you know what I mean?
Sure.
Yeah. So in the same instance, if you're, interested in bringing solutions into the market and you're out there doing the best R&D to go and source what is best, and you know yourself, oh my gosh, this is missing. Now everyone's going to have their differences in how they relate Of course. It's not like you're going to say, oh, it relates to me. One flower is going to relate to me. It's going to be the same for everyone. But you know what? There are those patterns that are fairly consistent. And if you've got a little team working with you and you can work out what you all agree on as the best, there's a pretty good likelihood that that's going to expand, right?
Yeah, well, that's why. Look, it's a great question, and it's incredibly frustrating at times. I think that's why the measuring stick needs to be consistent. So one of the ways that we measure quality, or one of the ways things that we don't measure is effect,
Mm,
because it's purely subjective.
yeah. You can also group
So
together again, wearing my own tracker
so
hat. Yeah, we've
yeah,
got some
so
really
what
good.
I think what I think of it is irrelevant. We've removed the subjectivity out of it so that we can be unbiased, so that it can be a
Yes.
meaningful tool to measure. So,
Well, it needs to there needs to be an understanding of effect, or why does it matter what you're taking?
well, because it's subjective, and when you add the other components up, then the effect is the outcome.
Of course.
So, right, if you've got all of
Yeah.
those things lined up, then the effect is going to be magnificent no matter what, right? What you're talking about then, this is a whole nother subject, is again at the start we talked about cannabis being far too broad of a term. We're
Yep.
talking about when we're talking about raw flower, we're talking about a collection of chemical compounds that interact with the human ECS. They also have other physiological and psychological effects, right?
Yeah.
Some of them, some cannabis gives you the wild munchies. Some of it gives
Mm.
you dry. Some
Mm.
of it makes you freak out. Some of it makes you not freak out. Some of it
Hmm.
makes you laugh your head off, right? There's all of
Yeah.
these things.
The other one
I
with
mean,
freaking out, some of the things it is like, because there's the connotation with that. Sometimes it's just the torch that's needed to make you confront actually what's in front of you. So it's freaking out, but it's also making you aware and placing this problem in front of you and being like, face it, right? And you freak out if you go, I can't deal with that, right? This isn't
it's
the way everyone wants to
see, you
confront
say
it,
that's
but
a
this is the way it is. Like I know what's in front of me. I'm not hiding from anything, and the plant brings it to you. It's a deep
I
way at
love
it.
that.
But that's
Hey, we never talked about that before, Chad, but I didn't
truth.
realize that you had some, psychonautical kind of
We got to flip the switch.
insights here.
There's a lot that I'm
Wow.
wanting to do, mate. I'm just getting started.
Look, philosophically, I think that the reason that cannabis is here, the reason that we have a relationship with it, and this is not going back into, without touching origin of the species and
Mm.
origin of the genus and all of that kind of stuff. But the reason that it's here is to teach us
Yes.
how to understand ourselves better and how to work with ourselves
Yes.
uh,
I would say on a
as a
micro level as well, because
on
psychedelics,
sure,
yeah, gets the big
absolutely,
praise for the macro, you know,
absolutely,
life-changing effects that it has. Cannabis,
absolutely.
slight micro adjustments that occur because it also is consumed generally regularly and
It's the little
frequently,
things.
which is why
Yeah.
you also to optimize it, you got to get it under control in some ways, which that's a topic for another day. I know we're talking a little bit, mate. So one thing that I think we need to shift to is the conversation around, well, we know that quality can be a bit of an issue. And it's evident from how you kind of broke that down. And we had another pod that we did on quality. And I love talking about this and it brings more attention. But it's also, well, where do we want to go with this? What is the take home for patients? Like, what is it that you want to share around potentially? Are there standards or like what is a mechanism or a framework moving forward that could be suggested or that you're probably thinking if you're here wanting to chat about quality and then leading it, I imagine you've got something you want to share.
Look, I would say, for me, I was a recreational cannabis user when I was at college. I'm happy to disclose that. I've got no issues around that. But there is no way that I would have been able to comprehend the quality of some of the medicinal products coming out of British Columbia, because technically we can't get products directly out of
Mm,
Cali,
yep.
right? Legally. There's no way that I would have been able to comprehend that quality until I experienced it for
Yeah.
myself. I
Yeah.
wouldn't have thought that it existed. I would
Mm.
not have thought that it existed.
Yes.
So I would say that if you're a patient who's even slightly interested in what we're talking about in variability of quality, go and try a few different products in the price points. So unfortunately, a lot of people just came here to make money and they're charlatans. There's products in some of those price points that are being peddled as quality that aren't. So it
Sure.
makes it it makes it it makes it challenging for somebody to say, "Oh, I'll get a tub for 175 because that'll be the best quality that there is." Unfortunately, the people that put that product there may not necessarily understand the fullness of quality as well. So I would say try a few different things across different price points and see for yourself what it is, you know, genuinely, like scientifically, see, what is this? What's the difference here? What can I determine? Like, what does it feel when I squash it? Does it go crunch, 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 crunch? It's over dried, right? The reason it's over dried is because it's probably old and the moisture content, when you reduce the moisture content, you raise the THC content, shouldn't be over dried. Should be 12 bloody percent moisture all day, every day, right? Does it does it go crunch, crunch, crunch? It's not quality. Throw it away, right? There's things like that when you
Sure.
break it apart. When you look at the pistils, when you look at the trichomes, how densely covered
Mm.
is the calyx with trichomes? Are there just a few here and there? Is it full of trichomes? Are the trichomes like this with big heads on them, or are
Mm.
they spindly little weak little trichome? The trichomes is where all the API is. When somebody knows what they're doing to produce a quality product, they produce a plant that bangs with trichomes. That's where all the good stuff is. So have a look at the trichome. The trichomes are a real measure of
Mm.
the competence of the grower and therefore the quality of the product.
One thing, right? So we're focusing a lot on patients, but
Yeah,
also if you're speaking more to the industry, what
sure.
standards or what are some frameworks? So if standards improve, patients get better quality. So patients can at the moment have their range for what they're going to explore. Yeah, under medical advice, of course. Uh, any ideas for what it could look like at an industry level? And you may not, and that's okay. And I know I'm pressing you here, but yeah, very, very curious.
Um, As in, what the benchmark should be for Australian producers? Look, I think that it. Sorry,
Yeah, that sounds good.
yeah. Look, I think for an Australian producer, you're mad if you're not looking at export markets. If you're looking at export markets, you need to be producing export quality. If you're looking at what export quality is, well, then British Columbia already import into Germany, into the UK, into every jurisdiction. So that should be your benchmark.
Great.
That should be your benchmark. And the prices have come down as well. So I can buy an order of magnitude better quality out of British Columbia than I can out of Australia as a supplier, right? So, and that's what a lot of companies are doing. I want to see the Australian industry thrive. We have a real opportunity here. We've got a great international reputation as producers of high
Mhm.
quality products. Um, I would say put the work in, bring the expertise from the place that is the benchmark. Try to bring people from BC, bring people from the States who have been growing for their whole life, for as long as you can imagine, and start uh, using the scientific approach. When you're collecting data, you need to be able to analyze and understand it. Maybe you need analysts, maybe you need scientists, maybe you need to employ somebody. It's not going to cost you a lot, but academics 50, 60 grand a year, whatever it is, well worth the money to understand what it is that
Mm.
you're doing and where the deficiencies are and how you can continuously improve.
Mm.
I would say a lot of the Australian producers are interested in it, but perhaps they don't understand how to go about it.
Do
A
they need to
great
look?
initiative.
Do they need to look overseas? One of the comments that we had on this podcast earlier, on an earlier episode, was around some of the issues that was shared on that
Mm,
last podcast was around that Australia went too much for corporate and too much for the boardroom, and probably not
Agreed.
enough balance between. Because what you're talking about there, people that have been
I
growing, people
completely
have been
agree.
growing in Australia, people have been growing unique genetics on a
But
global.
there was no amnesty on those. They weren't
Correct.
allowed to come. They weren't allowed to come to the market.
They
That's the
haven't the seed like the genetics haven't, but
yeah.
the people that have been growing.
The genetics and the people weren't allowed to come. And this was a what was his name? The Ozcan guy, the underworld figure. His name escapes me. Um, he went and worked as a grower who brought his seed bank with him into Ozcan in the really early days. Ozcan, one of the first ones to get their license. Schoenmakers, Neville Schoenmakers was his name. And he absolutely cleaned them out. He took money, he took shares, and he just head for the hills. And so, as a reaction to that, the ODC went, okay, we can't have anyone black market come to this industry. When we went to apply for our cultivation license, they wanted a list of every single person that I knew, their phone number and their address, right?
Wow,
Everyone. This
gotcha.
is this is crazy. But
Yeah,
it's a knee-jerk reaction to one like
yeah,
underworld figure who rolled these people over. He had this massive seed bank from Holland, and it would have been great because they were that's an Australian seed bank
yes,
with Dutch heritage generics.
sure.
That's what you want.
Mm,
So that's why I say bring people from overseas.
sure, sure.
I'm not saying that the competency isn't here,
Yes,
but certainly large scale protected cropping is what we're talking about. So, how many large scale Australian growers are still in the market looking for a job as a cultivator? You know what I mean? So,
mm,
I absolutely bring the Aussies in.
yes,
I think there's expertise there. Um, Now, I think those laws are a bit more relaxed. It's a great idea, but people that have done it, it's going to fast track your
yes.
growth. Absolutely.
Mate, one of the things about this podcast, we could talk on and on and on, but we need to kind of keep it a little bit condensed. So we're gonna have to
Well,
wrap up, which is unfortunate. But I do try to keep it
let's do
under
it.
40 minutes all the time. What's a final
Yeah.
thought? Can people find you anywhere? Is there anything like that you want to share before we wrap up?
Yeah, look, we've got products in the market. We do research, we do development. We are constantly striving to set those quality standards. We think that it's important. It's certainly important to me, and it's important to my patients. Um, Feel free to reach out through the website. There's forms. You can send me questions, or
Right.
if you want to chat further about something, I'm all ears. I'm here.
Excellent.
I'm here for you.
Excellent. Loved it, mate. Thank you very much.
Cool,
Appreciate it.
man.
This is High Living with Chad.
Likewise.
Thank you very much. All right, man.
Thanks, Chad.